Appreciate the governor and Secretary Levine's press conference. It's always good to hear from our state and get the news directly from them about what's happening across the Commonwealth. Here in Erie County today, we have no new confirmed positive cases in Erie County of anyone being infected by COVID-19. Again, no new confirmed cases. So we sit at 5 confirmed cases here in Erie County. Our negative cases so far have been over 200. I don't have that exact number, but that is a round number. We are still doing contract tracing by the Erie County Department of Health on those who have a positive test. And again, if you have not been connected and contacted by the health department regarding one of these cases, then there's an extremely low chance that you have to be concerned with one of our current positive cases. If you have been in contact with one of these individuals, you have been identified and you will, and probably most likely already have, been notified. We have received reports of phone scams that claim that people are from the Erie County Department of Health. If you receive a phone call from the Department of Health staff, they will leave a message with a number to call back. If you do not receive a number and you're left a message, you can always call 814-451-6700 and ask, did you call me? Because we do not want anybody being scammed throughout this time. And so be very suspicious and do not call back if the number was not given that I just mentioned to you, 451-6700. Second, we are in the midst of developing a rumor hotline. There are many rumors that always tend to pop up during a crisis such as this. We will be informing you of this rumor hotline and how you can access it probably tomorrow, if not before. And we also ask that if you have an appointment with the Erie Department of Health, we still have clinics ongoing. We ask you to call the health department before you arrive so you have an appointment time. Again, our number 451-6700. That way, we can limit the number of people in the health department at the same time, but it's important that we continue the very important work of our health clinics that protect us from many other diseases in Erie County. Public inquiries and concerns related to COVID-19 in Erie County should still go through the county's health department or eriecountypa.gov, but you can also contact ECDH-info, I-N-F-O, so that's ECDH-I-N-F-O at eriecountypa.gov. And that goes along with the phone number, 451-6700. So we want to make sure that you can get your information answered, that you have the questions that you have answered. The stay-at-home order that was issued yesterday, of course, has raised a lot of questions, and many are calling for clarification. We have guidance available on our website, eriecountypa.gov, under Resources on the COVID-19 page, which is right on the front of our website. We want to thank all of you for your patience as we continue to add more information to that site as quickly as possible. We are launching and have launched today a new community chat line. This is a free support network for those who are experiencing emotional distress. Community professionals will be available to help guide you to available resources within our community and to be someone you can talk to, someone you can ask questions to, maybe even express the feelings that you have inside, and that often is helpful. They will answer questions regarding COVID-19, giving you the right resources that you need to be knowledgeable. And I always say knowledge is power. Although the community chat line is staffed by mental health professionals, it is not a crisis line. Obviously, if you are feeling thoughts of danger to yourself or to others, we ask you to call crisis. But for those who need to just talk to a caring individual, that chat line is available to provide that empathetic listening for adults of all ages during this difficult time. The number for this chat line is 814-273-3777. 814-273-7007. Again, 814-273-7007. It is operational as I speak. Initially, our hours of operation for this chat line will be 8:30 in the morning to 5:00 p.m. Monday through Friday. The hours of operation will be reviewed regularly and could be extended if we find is necessary and needed. And I want to repeat that number one more time, 814-273-7007. There are additional resources available on our website, eriecountypa.gov. And on another note, donating blood is an essential task associated with the community's health and safety. The Community Blood Bank is the blood provider to our local hospitals, so they ask you to please book an appointment for blood and platelet donations throughout the coming weeks. We have been in close contact with the Community Blood Bank, and you are encouraged to continue to donate blood during this time. It's one of those things when you don't know what else to do that you can do for your fellow citizens in Erie County. They ask you to book an appointment at the Erie Donor Center or any of their mobile drives by calling 456-4206. That is 814-456-4206. Life-sustaining businesses are still functioning, as we know, and we have enforcement inspectors continuing to make their rounds as we have concerns called in or businesses are unsure whether they should be open or not. So far today, 25 new complaints have been entered into the database and 10 more field inspections have been completed at the time of this press conference. At the state level, the Pennsylvania State Police released data on actions taken yesterday, March 24th, against non-life-sustaining businesses that failed to comply with Governor Tom Wolf's order, closing their physical locations, and that was 44 total. That is for the Pennsylvania State Police. And I'd like to speak to our employees for a moment. No one should be coming to work for you if they are sick. We ask you to please make sure that none of your employees are ill if they are physically coming to work. Obviously, employees who have tested positive for COVID-19 and have had symptoms would be instructed by us not to show up to work. They've had contact with the Erie County Department of Health, and they should know that they cannot return to work for a minimum of 7 days after starting of their symptoms, and they must stay symptom-free for 72 hours or 3 days. This means if an employee is still having symptoms after 7 days, they cannot return to work until that additional 72 hours has passed without fever and without using medications to reduce the fever and an improvement in the respiratory systems. So I'm asking our employers to help make sure that they're not requiring employees to come to work who are still sick, whether it be with COVID-19, the flu, a cold, or any other illness. Some more guidance for the public when visiting businesses and grocery stores. Take advantage of technology. Use the shop online services that our local grocery stores offer to help limit the number of people in the store. Again, whenever possible, we urge you to have only one person in your family enter the store for the shopping. Certain grocery stores have now banned the use of reusable shopping bags in the stores. I love to use my reusable shopping bags personally, but now is not the time to use them. So I recommend that everyone use the disposable bags at the grocery store and then throw them away. Do not keep them for further use, as they may potentially have a virus on them. And so the safest thing is to use the disposable bags and then throw them away. Additionally, the Erie County Courthouse will remain closed to the public now through Monday, April 6, 2020. This is an extension of the original date, which was Sunday, March 29th. Now on to some of the state numbers, which I know were already mentioned, but I just want to reiterate that we have a total of 1,128 cases in Pennsylvania. We have one more than what's on the state website because we know that the state has not counted our 5th case in their number. This is across 44 counties. And with 276 new positives just since yesterday across the Commonwealth, and now with a total of 11 deaths across the Commonwealth, we can see the seriousness of this, and we can see the numbers rising, and we here in Erie County are doing everything possible to limit those numbers rising here in our community. So with that, I would like to now turn it over to questions from our media outlets who are with us today. And I ask you please to remember to keep your mics muted until it is your time for a question. And today, I will start with WJET-TV.
Yeah, hi, Kathy. It's Samir. So I guess my first question is, from those people or the cases that were contact spread, how many tests are we waiting for with people those people came into contact with?
The people they came in contact with most likely are not getting tested. Those people are under a 14-day quarantine. So we have asked those individuals to quarantine themselves in their home, to not go out, to not be amongst other people, and do that for 14 days to make sure that they have no symptoms. If they start to exhibit symptoms of COVID-19, then they would talk to their healthcare provider and most likely would be brought in for testing.
Do you have an estimate of how many tests were, or ballpark of how many tests we're waiting for back in Erie County?
We do not have that number. We are not doing the testing at Erie County Department of Public Health. Those are being done mostly by our two large health systems, Allegheny Health Network and UPMC, and there are some private physicians also doing testing in their offices and sending those to labs. So we do not have a clear idea. We only know when we have what they call a person under investigation number, and I don't even know what that number is right now. Erie News Now?
Hi, I'm hoping you can hear me. We're wondering what you've done in terms of wondering what you've done here in terms of enforcement on this ban, the stay-at-home order. What have police, if anything, been doing at this point, and have people been complying by and large here as we're not quite one day into this?
By and large, people are complying and businesses are complying. We've had enforcement teams out since Monday, mostly dealing with businesses, but they can follow up on any concern that's out there. So when it comes to the businesses, the majority of them have been compliant. We have had very few that have refused. Actually, I think we had one that was maybe a concern, but that business is now closed. So we feel very confident that that it is working in that regard. In terms of individuals, we are not looking to arrest anyone. I've spoken, obviously, to our district attorney, Jack Denieri, and what we want to do is help people make the right choice and do the right thing. So any police agency could give a warning if they saw something occurring that shouldn't be occurring, for example, maybe a large group gathering in an outdoor space, and then they would advise people of why we need them to disperse and why people need to be socially distancing themselves from each other. And obviously, if something occurred and it just no warning, the warning was given and nothing was changed in terms of the behavior, we could eventually get to a place of citation. But again, most people, and I think most groups, and what we've seen so far, is that people will comply, and sometimes people just don't understand the importance of it and just need to hear it again.
Thanks.
Erie Times News?
Kathy, it's David. Just on what you were saying about the businesses, you did say one was ordered closed. Is that? Can you give any more details on that?
We had a business who that was visited. It was ordered to close. Signs were posted, and then the next day we went out, and there was still activity going there. So again, it's closed, and we have had assurances from that business that they now will stay closed. So those are that's probably the most difficult business we've had to deal with, but the vast majority of them, all the rest, once we go out and explain why they need to close, they do. But sometimes when we go out there, those businesses have a waiver, and we didn't know they had a waiver, so that takes care of the issue if they have a waiver from the state. And then we just try to inform the businesses of how they can best put in procedures that will keep the people that are working there safe, as well as the people that would be coming into that business.
Did it reach, for that one business, did it reach a situation where they were actually cited or fined or anything, or did it not reach that stage?
It has not reached the stage where they are fined at this point, and we hope it doesn't get to that. But we are watching that business very closely. How about Talk Erie?
Hi, Mr. Dahlkemper, it's Joel Natale. Just wondering about when we've succeeded to flatten the curve. What is the metric that you're hearing from either the state or the local health department or your peers in other county governments? Basically, what is success? How is success identified with all of these social distancing efforts and stay-at-home efforts that we're doing?
So, Joel, I don't know that I'm qualified to give a complete answer to that. What I do hear, not only across the Commonwealth but across the country, is no one believes we've reached the top of the cases we're going to see yet, that the surge, as they're calling it, is yet to come. And so, what we see in other countries is, as you have this slow rise, and then all of a sudden you see this trajectory that moves significantly up. And we are seeing that in places across our country and even in some counties in our Commonwealth. And so I believe Allegheny County is up to 88 today, and I believe it was at maybe 48 yesterday. So that's the kind of trajectory that you're starting to see in some of these counties with many more cases, and we expect that that's just going to exponentially move on up if what we are experiencing here mirrors at all what has been experienced in places like New York City, Italy, China, and others. So obviously what we would see, I think, is that surge that goes up, then eventually you're going to see it level out, and then you're going to start to see the numbers come down. Of course, in China, in the most hard-hit area, they're reporting no new cases, but they haven't even completely gone back to normal over there. So those are the things we can watch to make better decisions over here, is what happens in other areas that have been hard hit already. WJET-TV?
Yeah, I wanted to circle back. You said there have been, for the state police, was that, comment with the 44, that number, was that like Erie County, or was that across the Commonwealth?
I believe that was across the Commonwealth. We're in a little bit different.
And then I guess
we're in a little bit different place here in Erie County. Obviously, our state police are out, but we have enforcement right in county government because, again, we have our own health department, and we have an enforcement team. That team going out has law enforcement from county government, whether that be sheriffs, probation officers, or detectives. So we're utilizing our own internal team for much of the enforcement that the 57 counties without health departments have to really rely on the state police to do that. So again, very fortunate in Erie County.
And then I guess overall, how do you think the stay-at-home order is going?
Overall, I think it's going well. I think people understand the importance of this. I've had many people reach out and thank me and thank us for what we did here. I think many people understand the seriousness of this. They want us to protect their health and the health of their loved ones. And as the governor made a very interesting comment, I thought, on his press conference. Just assume that everyone has COVID-19. If you assume that, and maybe you assume yourself may be a carrier, then if we all do the right thing, we're going to stop this thing from spreading. I don't believe every one of us has it, but it's that action, it's that behavior that you would then use if you had that feeling that everyone that you might encounter could potentially be a carrier. So by staying home, staying within your family group, going out for a walk or a bike ride or a jog or a hike, and socially distancing yourself from anyone you come upon, spending as minimal time as you can inside of any kind of a building, like a grocery store, a convenience store, a pharmacy, and when you go to work, make sure that you're using good hygiene for those who have to go to work. That would, of course, be washing your hands for 20 seconds, using sanitizer. I'm recommending when you go home, I know that I'm doing this, taking off my clothes that I'm wearing and putting on a new set of clothes so that I'm trying not to carry a virus into my own home. So those are the kind of things I continue to talk about with everyone, and I think people are really trying to do their best in our community. It's not easy. I know that. We all want to see our family, our friends. Some people live alone. Reach out to those that you know and love and care about, especially if you know someone lives alone. They need to hear from you, and you can do your part by reaching out to them. Erie News Now?
Hi, yes, this is Brianna Andrews. Hopefully you can hear me.
I can.
In regards to the community hotline, will medical personnel take part in this hotline?
So we do have medical professionals there, and mental health professionals, social workers. That's who will be participating. This does not replace crisis. Does not replace anyone who is in active treatment for mental health. But we know that many people are very anxious. As I said, some people are living alone and feeling very isolated. People are having questions, they're hearing things, and they just don't know what to believe and what not to believe, and that makes people more anxious. So we think between our community talk line and our rumor line that we can help people better emotionally and mentally handle the stay-at-home order and just all of the issues surrounding the pandemic. I'm really grateful to the county's Department of Human Services and Erie County Care Management, who really came together and figured out how we could do this with the personnel that we already have in-house, and that we could man this line and have caring people on the other side to talk to you. And so we hope people find it beneficial. If we find the need is there, we will expand the hours. We're going to see how this goes for the first days here, and I appreciate everybody who's worked hard to make this happen. And on the rumor hotline, we're actually using library staff, because who are better researchers and who can find the resources better than a librarian? So we are going to use the staff that we have, again, in Erie County government to put together this service for the citizens of Erie County to try to bring the best, the most accurate, and the truthful information out to the public. Erie Times News?
Kathy, do you have a number for the number of business exemptions that have been granted for the county?
We have not received that list from the state. I've asked for it pretty much every day, and we have not received that list. My understanding is, I did talk to the Secretary of the DCED earlier today. He said they're still processing these waivers. Well over 13,000 of them came in. They are trying to get through them as best they can. There are still some pending, and I believe some businesses in Erie County are still waiting to hear. So lots of work that, was way beyond, I think, what they expected it to be. But hey, these things are all evolving in real time, and so we all, I think, need to be a bit patient. But it would be great to know, because sometimes my staff's time is being used up in going out to a business that has a waiver where we wouldn't have to do that and utilize their time to do that if we had that list. Talk Erie?
Sorry. After all of this, we have to have some kind of economy left. What kind of coordination is happening with your economic development team, with the regional chamber, with the redevelopment authority, and so on, to make sure that small businesses and sole proprietors here in Erie County are getting the benefits that they're, whether it's from the federal or state government? Are we going to use this bully pulpit to make sure that they understand where they're going? Because there's a lot of confusion out there.
Thank you for bringing up that question, Joel, and I was going to try to get a little bit deeper into that subject tomorrow, but since you brought it up, I'm going to just talk about a few things. We know that today the state released $63 million for PETA loans, and all of this information that is available for businesses and any resource can be found on the Erie Regional Chamber and Growth Partnership website. And the Chamber is working with the Erie County Redevelopment Authority, with the city's Economic Development Department, and really all of our economic development entities. I know they all have a phone call tomorrow, and I wanted to try to gather any more information from them I can to bring forward to the businesses through this venue. But go on the Chamber's website. That's where you'll find all the resources for Erie County. Through the Redevelopment Authority, we were able to free up $1 million for operating loans for businesses, but with the number of requests that have already come in, I was talking to the director there, and we believe that money is probably going to be used up quickly. That's how many businesses need this. When it comes to the PETA loans, the $63 million that's going to be across the Commonwealth, you know, the secretary of the DCED said, you know, $63 million, a lot of money, but it's a drop in the bucket for what the need is going to be across this Commonwealth in the long run. So they're trying to get money out as soon as they can. Their goal is to try to have that money be able to be released within about a week. And we're looking here in Erie County and across the Commonwealth that this money would go to the most vulnerable businesses, those who are most hurting at this point, and trying to make sure that businesses can stay afloat during this time. There will be more help coming, we know, from the federal government with the stimulus package passage there. And the state obviously is continuing to look at other ways they can be of assistance. Our Erie County Gaming Revenue has put some funding along with Bridgeway Capital to work alongside the Erie County Redevelopment Authority funding. Again, all of this information is brought together on the Chamber's website, and we have just our economic development personnel working completely together with each other, helping each other out to process these as fast as they can, get money into the hands of the businesses in our region, which is so key. I will say I'm pleasantly and almost very surprised that we've actually already seen money in the county health department that was promised by the federal government in their first stimulus package, and we got word that it's released yesterday. They said they'd have it done within 30 days. They actually did that, and that's the kind of speed we need with all of this money as it comes out. And so I'm very grateful that federal and state are really looking to see how, if they get this money approved, how fast they can get their staff and all their processes to be done and get the money into the hands of whether it's the business or the person who needs that money. So let's hope that this speedy process we saw with that first stimulus money out of the federal government continues as we go forward. Jet TV, do you have any final questions?
Yeah, do you feel, I guess, Erie County is kind of ahead of the curve right now with, since we don't have that many cases, we only have the 5 confirmed positive cases?
I believe we are in the best possible place we could be right now, considering what's happening across the Commonwealth and what's happening across the country and the globe. You know, one of the reasons why I really wanted and spoke to the governor, and he agreed with me, why Erie County needed a stay-at-home order was because I'm watching the 3 cities that surround us, Cleveland, Pittsburgh, Buffalo, and those counties. And I know how connected Erie County and this community is to those 3 cities, whether it's for health care, whether it's because you have family members there. People have to go back and forth between those cities for those specific reasons that are life-sustaining reasons. And I am very concerned that that transfer back and forth between those communities could increase our numbers drastically. And so that is why I put extra protection over Erie County right now to try to minimize any spread of COVID-19. We know that the 5 cases we have are either because the person traveled outside of our county, or second, they had a contact with one of the positive cases. So we believe if we can stop what we call that community spread, where you don't know where you got it from, then we can keep these numbers at a reasonable level and hopefully not see the devastation we've seen other places. So this is really a measure for us to try to take on early, be more protective of our community, and then hopefully have better results. Erie News Now.
Hi, Ethan Kibbe here. I've had 4 or 5 viewers call and ask me about this. They're wondering what they should do in terms of like a custody situation if they have a child who lives with another parent outside the county. What would they be wise to do in terms of when it's their, their opportunity to spend time with their child, what would be the right process in terms of going and getting him or her, and then what should they do upon return?
Gosh, that's a really good question, and it's the first time that anyone's asked me that. So I guess I'm going to speak just from my knowledge and what I know about COVID-19 and what I know as a parent. Of course, your child wants to see you, and you want to see your child. I would have a very frank conversation with the other parent to know what they are doing, how they are protecting themselves and your child while they're in the custody of that other parent. I would also tell them what you're doing and make sure that you have that really good communication going back and forth. Some of these children may be living in an area where we have a much higher case of COVID-19. When you bring them into Erie County and into your home for that visitation, then I would be obviously very careful about what you do while you're with them. I would limit their exposure to any other place in Erie besides your home. I would use all of those hygiene practices we've been talking about, with making sure your house is cleaned well and put new clothing on them when they arrive, wash their clothes. Once you wash their clothes, there's no more virus on the clothes. And so, again, kind of going back to what the governor said, if you think in the fact that COVID could be with any person that you might come in contact with, do everything in your power to try to limit that, bringing that virus into our community and into your home. But I don't expect anyone not to see their child during this time in those particular situations. But I think it really takes good communication with the other parent, and I think it takes diligence on the part of the person who's picking up their child and bringing him back. And I guess I'm just saying that from my heart as a mother, as a grandmother, and as somebody who really cares about this community. Think about those things. And if you need any more advice on that, I would call our number at 451-6700. That's where our nursing staff is at. That's where our health professionals are at. And they may be able to answer that question in a better way. And you can also call whoever you work with on the custody side. If there's any other county connection that you have, please feel free to call your caseworker on that if you have one. Thank you.
Thank you so much.
Erie Times News?
Sure, Kathy. You had mentioned the concern you have about folks traveling here from Cleveland, Pittsburgh, Buffalo, and other areas. What additional measures have been considered, whether talking with your staff, talking with the city staff, talking with state folks, to reduce or screen folks coming into Erie County?
So there's no way we can stop people from leaving our county and coming back and forth. But what we can do is ask our, you see the signs. If you are out driving, there's signs on our highways, on those big electric signs that say do not travel, stay home. That's what we're asking people to do. If you don't have to travel, don't do it. But I know I've heard of people who need to go to Pittsburgh, for example, or Cleveland for some medical treatment. And obviously that's necessary and life-sustaining. But again, all of those precautions that I talk about need to be not only done, but need to be done more diligently, and you need to really be thinking this through. Every bag you carry, everything that you move back and forth, how can you make sure that you're not carrying a virus on that? How can you clean it? How can you minimize any potential of carrying that virus back and forth? So, we're not going to put up blockades on every road that comes in and test everybody with a thermometer. That's completely unrealistic and something I wouldn't even begin to recommend. But I think if each one of us just thinks and asks questions and gets answers to these, again, if you really have a question about any of this, you can call that 451-6700 and ask that question to keep your family safe and to keep yourself safe, and ultimately to keep our community safe. Talk Erie?
Yes, one more question, and I apologize if this is a repeat, but did you mention how many negative tests came back for today? We
have over 200 negatives. I don't have the exact number, but that's not just today. That's
Thank
total.
you.
That's total.
Okay.
Okay.
Thank you.
Any last burning questions from any of our media outlets out there?
Kathy, it's David again. Just confirming that none of the 5 cases have been hospitalized at this point?
None of them have been hospitalized. They are all at home convalescing, and we expect that all of them will have a complete recovery. After they are done with their symptoms, they need to be still in isolation for another 72 hours, and then they can be back out in the community, just like we all are, social distancing themselves, but certainly able to kind of resume the new normal that we're all living under. Anyone else? Well, thank you very much. I really, again, want to say how much I appreciate our media outlets really getting the word out to people. And I really truthfully want to say thank you to all of those who are doing the right thing, helping us do the right thing, staying at home, social distancing, washing your hands, just listening, finding the right resources, and also reaching out to your neighbors and seeing if somebody needs help. Can you get groceries for them? Do they need a phone call? What can you do for others today? Can you give blood? We actually asked for volunteers to help with homeless shelters, people who are younger and healthier and wouldn't be as high of a risk to be helping us. So all of those things are things that you can do at this moment. I thank my daughter who went and got me groceries today and is dropping them off in front of my garage door so she doesn't come into my house and I don't touch her and she doesn't touch me. So those are the things we can do for each other. Thank you for being our partners in this. Again, stay home, stay safe, stay calm.